Welcome to Medicobuzz and welcome to the section 2 of bacteria. We'll learn spirochetes and today number second species of this little chart, the Leptospira interorgans we will learn. Leptospira interorgans. These microorganisms are spirochetes, which are spiral in shape with the hooked ends. Leptospira stain lightly on the gram staining, so it does not stain on the light field microscope. Dark field microscopy is used to see the leptospira. Bacteriologically, the growth can achieved on the serum media. The carriers of the leptospiras are rats, dogs, and the livestock animals and rodents. These carries the leptospira. They contaminate the urine, and that contaminated urine further contaminate the water and soil. Swimming in contaminated water and the ingestion of that contaminated water can cause the leptospirosis, which is the infection caused due to the leptospira. Miners, farmers, and swears are at the high risk of the leptospirosis infection, and leptospirosis is common in the tropical countries. Leptospirosis. It is an infection caused by the Leptospira interorgans. When the ingestion of Leptospira species occurs, then Leptospira species circulates in the blood through hematogenous route into the blood and then multiply in the various organs and cause the complications. The most prominent symptoms occur in the leptospirosis are jaundice, photophobia, conjunctival erythema, which is the diffuse redness of conjunctiva. We can also see flu-like symptoms in leptospirosis. The flu-like symptoms includes fever, headache, chills, and myalgias. Leptospira can also cause the Weil's disease, which is also part of the leptospirosis. So organs affected are the triad includes kidneys, lungs, and the liver. So firstly, liver dysfunctioning can occur. So the liver dysfunctioning, you may see the liver pathologies such as jaundice, and renal failure can also occur. Anemia and hemorrhage, massive lung hemorrhage can occur. So you can also see the hemoptysis, coughing up of the blood in the clinical signs. And diagnosis is based upon the clinical signs. These all you will judge in the leptospirosis patient. And there is a severe rise in the IgM antibody. Blood culture and urine culture are also used to detect the leptospirosis. Leptospira can be found in these both tests. Treatment includes penicillin G is the drug of choice for the Weil's disease and the leptospirosis. Penicillin G is the beta-lactam antibiotic which contains the beta-lactam ring and that inhibits the cell wall synthesis of the bacteria.